treatments. So it's really nice to see you all. Thank you all for joining on this day in July. For those of you who have just come back from holiday or thinking about going on holiday, it's really nice to see you. So the purpose of the meeting today, this town hall meeting, in fact, is something that we've been thinking about doing for some months. We wanted to have the opportunity to, I hear an echo. If everyone could put themselves on mute. Thank you. So we have been hearing that some members would appreciate having an overview of what's going on in the different working groups. And we've also been making some good progress in terms of clarifying next steps with the program, with the recent board meeting that we had in the end of May. And so we thought it might be helpful to have a moment when we can come together and basically share, look back on our achievements and also share how we're moving forward and to give you a better idea of how you can contribute in the months to come as well. So that's kind of the purpose of the meeting today. If you could go to the next slide, please, Sylvia. So in terms of agenda, what we'd like to do is to start with a quick overview of what has been happening in the last few months. And since there are several of you who are new to the working groups today, we thought it might be helpful to give a quick reminder of our approach, what we're aiming to do as FT3. And it might be helpful for those of you even who have been working us for the past few months to have a little revision to set the scene properly with the discussion for the rest of the town hall meeting of what we're aiming to do. And then really the bulk of the discussion today is to share with you the outcomes of the board meeting and to explain to you how we are moving forward and how we are moving forward specifically with the working groups. And you might have seen some emails about moving into working groups or subgroups focused more on production. And so what we'll do is we'll explain to you exactly what those are, what the objectives are for each of those subgroups, what we're aiming to do, what has been done, what's coming next, so you know exactly how you can participate. And then there will be a Q&A. However, there is a change that I would like to propose. What I would like to do is, as we are going through, I'd like to pause and just invite you to ask questions as we go forward. It's supposed to be a town hall. It's supposed to be just a relaxed meeting where we share with you and you can learn about what we're doing and get answers to your questions. So we don't need to wait until the end. And indeed, if you have any questions that come up, you can feel free to use the chat, and that way we can react as we move forward. Does anyone have any questions then before we move on? No? Okay, in that case, if you can move to the next slide, please, Sylvia. So we wanted to start by saying thank you to everyone, because we are now looking back. It's been about a year now since we officially kicked off the From Testing to Targeted Treatments program, and we have been really impressed by the amount of progress we have made. As you know, we have been working together with you and making a lot of great progress in terms of identifying common gaps and needs in precision medicine. And we have also started to develop tools and solutions this year. For those of you in the Education Awareness Working Group, you'll know that we have been developing, for example, a tool, a resource, a Q&A resource, which is a parallel resource for patients and healthcare professionals, which is now in consultation with the healthcare community. For those of you in the Systemic Barriers and Opportunities Working Group, have been working on developing country and condition cards. We identified 75 different access barriers, and we're now developing 2 prototypes. We're starting with the Netherlands and Ireland, and that's making some great progress. We have also been starting to conduct some interviews for the Stakeholder Expectations Matrix. The Data and Evidence Group has been doing some really important work in looking at different data models and looking at how we can encourage responsible data sharing among the patient community. And all of this is really thanks to your great support. And just as a point of comparison, we have another collaborative program that we have worked on at the Synergist. And this program took 18 months to even achieve the first kickoff meeting. And so to take a year to kick off and to be able to achieve all this is really a great achievement. And it's really thanks to the contribution from all of you. So we really wanted to say thank you. And if you could go to the next slide, please, Sylvia, just to recognize all of you, the contributors and the founding members around the table today. Some of you are not here today, but it's really thanks to your hard work. And this is really important that we recognize that it's a co-created effort. And indeed, all the learnings that we will be sharing with you is the result of your input. So we really wanted to say thank you for that. Next slide, please, Sylvia. So what I wanted to do, and especially given the fact that there are a few of us who are new today, and to set the scene properly, is to go back a little bit to the beginning and remind everyone of why FT3 and how our approach is a little bit different from other precision medicine approaches out there. So if you could go to the next slide, please, Sylvia. So you might have seen, some of you might have seen this slide before, but one of the learnings we made when we came on the From Testing to Targeted Treatments program was how fragmented the precision medicine landscape was. And we were discovering that it was very complex, of course, from a topic perspective and in terms of the rapid rate of change. I mean, you have new developments happening all the time, and that in itself is really hard to keep track of. But also in terms of the different actors participating in this group, we have different kinds of stakeholders who are involved in precision medicine. You also have different kinds of initiatives who are involved. Different kinds of geographic focuses and condition focuses. We have, patient advocates, for example, from all different corners of the world, all looking at different kinds of things. In terms of the different kinds of initiatives dedicated to precision medicine, we have some that are focused more on policy issues, others that are focused more on education and awareness, others that are focused more on the data side. So there's really a lot happening, and it's very complex. And what was important when that came up when we were speaking to members and contributors, and which still comes up in our discussions today, is the importance for you that we are not duplicating work. And so something that we have really been clarifying recently is the importance to bring together this landscape and make this whole landscape work together and to fill in the gaps in between. And if you can move to the next slide, please, Sylvia. And why is it important to address fragmentation? Well, a fragmented approach basically will have limited impact. And in order to have sustainable impact, really the idea is to reduce these silos and help us all work together. And where do we see fragmentation? Well, we see fragmentation in terms of objectives, in terms of the ideas that different people have. There's fragmentation, of course, in terms of geography. And I know this comes up a lot in our discussions. Also in terms of condition focus, and also really importantly, fragmentation in terms of leadership. And it's actually this absence of leadership that FT3 is aiming to fill. And if you can move to the next slide, please, Sylvia. And this is something that we have really, I think was always there, but we have really clarified in the board meeting that happened at the end of May. And what we have really clarified that the role of FT3 is to act as a catalyst and an accelerator. And what we are doing is essentially pulling together learnings and good practices and making them translatable so that others can benefit from that. So very concretely speaking, what we are doing is we're bringing the right people together and building a forum to co-identify common needs and missing gaps. And this is something that we have really been focusing on in the first few months of the year. We have also been identifying and pulling together learnings and making them more accessible and usable for others. And often this is us exploring and making learnings together, but the question is, how can we capture the learnings we're making and put them somewhere so that others can benefit from it and they don't need to go through that same journey themselves? We are also identifying good practices, building on them and making them replicable. Where we identify a need, but good practices don't exist, we are co-creating new solutions. And finally, and this is really important, we're building a community of ambassadors. So we call this the FT3 community of practice to co-create with us and to share and disseminate our activities. So this is really the essence of what we're trying to do in FT3. And there are two outcomes that we're aiming for. First of all, what we are aiming to do is to create a suite of practical resources. If you could just go back one slide, Sylvia, please. A suite of practical resources to help accelerate precision medicine in different contexts. So resources that can be used in different contexts that are building on good practices. And second of all, is to build a positive momentum to be able to reach our shared vision. And this positive momentum is something that comes up a lot in discussions we have with you. And we have heard that it's important to be able to build this momentum or have an initiative that's focused on building this momentum. Because when we look at precision medicine from the perspective of different individual stakeholders, it's not necessarily a priority for them. So for example, a patient organization is there to serve the need of its patients and the disease condition it represents, and not necessarily precision medicine. And we've heard that it's only because of the forum that FT3 brings together that we're able to make it a priority. So this is really what FT3 is aiming to do. Do we have any questions at this stage? Because it's quite an important aspect for all of you to understand and for us to understand all together. No, and don't be afraid to write in the chat if you have any questions as they come up. Next slide, please, Sylvia. So when we were establishing the program, we were discussing with members, okay, what is it? Where do we feel we can really move the needle and make a difference? And we established 3 different strategic pillars to focus on. And these will probably be familiar to you because the working groups were established to support each of these strategic pillars. We have a shared goal, and this shared goal is to make precision medicine an accessible reality for all patients who could benefit from it. And what I will do is I'll walk through each of these pillars in turn. And I know that this will be repetition for some of you, but I think it could be helpful for the discussion that follows so that everyone kind of remembers what we're aiming to do and how everything fits together. So the first pillar is on support, data, and evidence development. So if you could go to the next slide, please, Sylvia. And so what we're doing here, why is it that we're focusing on data and evidence? And the reason why is that members were saying that, a real problem that we face today is we're lacking a definitive body of evidence to really demonstrate the value case for precision medicine. And in this working group and in discussions with members, we identified 2 different ways that we're aiming to address this need. One is by supporting responsible data generation and sharing. And this has been a focus for this working group in the first few months of this year. And second of all, and this is where we'd like to focus a bit more on moving forward, is to support the use of real-world evidence and informing healthcare decision makers. And some examples of how we are solving this need is to bring together case studies and examples such as patient stories and making it actionable and available for advocates and decision makers. Next slide, please, Sylvia. The second pillar is on providing education and tools. And why are we focusing on the strategic pillar? Well, it's because we know that a more informed patient leads to better outcomes, but today we're lacking a comprehensive and accessible information around precision medicine. And this was a learning that we made in the education awareness group at the end, I think the end of last year, the beginning of this year, when we were doing a mapping of different kinds of resources that were already available around precision medicine. We found that there were actually quite a lot of resources out there, but they tended to be quite piecemeal. Like there were a lot of resources in different disease conditions that kind of touched lightly on precision medicine, but not necessarily a real comprehensive resource that was pulling everything together on precision medicine. So that's the kind of thing that we identified was lacking. And so how are we addressing this strategic pillar? Well, first of all, we're helping patients and healthcare professionals be more aware and support them in making better, more informed decisions, but also helping them to take appropriate actions and at the right time. And this at the right time aspect is something that is really important for you. Testing, for example, has to happen at the right time for precision medicine to work properly. So this is something that has really been coming out and that we're taking into account as we're moving forward. Second of all, bringing together existing good practices to be able to create resources and support based on these learnings is something else that is important and that we'll be focusing on a lot more moving forward. And examples of what we're doing here is to create resources, trainings, and support for patient organizations that are adaptable to the local context and providing clinical decision support and trainings to healthcare professionals. And if we can move to pillar 3, please. And the last pillar is building the accessibility conditions for precision medicine. And why is it that we're focusing on this pillar? Well, what was important for members was this realization that for the patient to be able to ultimately benefit from precision medicine, it's not enough just looking at data and evidence or education awareness, but we really have to think about how we can help the whole health system work together and address all access barriers all along the patient pathway and access barriers that are experienced by all stakeholders as well. And so this is the pillar that's really focused on doing that. How we are doing that? Well, first of all, we are creating resources and again, this momentum to be able to address these access barriers. And second of all, we're focusing on creating a multi-stakeholder network that can really come together and work together to create solutions. And if you remember the image of the fragmented landscape at the beginning with all the bubbles, the idea is to link these different bubbles together so that we're working all together as one. And some examples of that would be to identify best practices in addressing access barriers and making them replicable, and also to develop advocacy tools, and the country and condition cards that we're working on is one example of that. So if you can move forward, please, Sylvia. So one of the, if I take you back to May and moving into the board meeting, something that we were hearing is we were getting some questions about, first of all, what we were planning on doing in the immediate next steps of FT3. And on the other side, we were getting questions about what we were planning on doing really in the longer term, like what was the 5-year vision, the 10-year vision. And in hearing these questions, and we were also getting questions about, as a global program, how were we practically aiming to be able to provide resources and support at the local level, knowing that precision medicine is very different from one country to another. And hearing these kinds of questions, we kind of identified a need to clarify a methodology or a deployment plan for exactly how we could reach the ultimate goal, which is to make precision medicine the accessible reality for all patients who could benefit from it, as you just saw. And so what we did was we clarified a deployment roadmap, which I will share with you today. And this was discussed and validated at the board meeting. So if you could click next, please, Sylvia. So the roadmap has 3 steps. So the first step is in the short term, and this is really what we are doing and what we have been doing until now. So the FT3 members and the collaborators, or the FT3 community of practice, what we are doing have been co-identifying gaps and shared needs and developing the first tools and solutions. The next step, if you could click next again, please, Sylvia. And so this was really a point of clarity that, that wasn't there before. So what we clarified was that in the first instance, what we would like to do is to target precision medicine champions first, or rather early adopters of precision medicine, and equip them with a toolkit that is that is designed to be localized and adapted. And the idea is to pull together learnings and good practices to create these resources, and it will be a suite of resources for patient organizations, key opinion leaders among healthcare professionals, and key health system stakeholders. And this is designed to be adapted, and we would provide the support to adapt that. So really focusing in the first instance on key stakeholder champions is what we would do in the first instance. And then finally, in the longer term, then would be targeting individual patients and healthcare professionals. And the reason why we have clarified this approach is because there were these questions about how would we practically be able to get, on the ground, if you will, with resources, given the fact that there requires so much adaptation to the local context. And working first with champions is also a way to be able to work with ambassadors and be able to cascade down. So this is something that was quite important to clarify, and this will have an impact on the work that we are doing together with you. Do we have any questions on this so far before I move on to the next point? If not, if you could click next, please, Sylvia. And we have also identified some strategic drivers for deployment, and these strategic drivers apply to each of the strategic pillars, so each of the areas of work that we are all working on. The first strategic driver is all about gaining insights using examples. And how are we gaining insights? Well, we are looking at patient stories. We are looking at examples from different healthcare systems, and of course, pulling and continuing to pull together learnings from other precision medicine initiatives, which is something that we have been doing across all the different strategic pillars. Then using these insights, the idea is to identify common learnings and good practices, and this might involve building on existing resources. So for example, the research, I think we mapped like 100 or 150 different patient resources already in the education awareness group, but building on these existing resources, pulling out what aspects are common or that could be made adaptable. And then the first step would be to develop translatable tools and support for precision medicine champions. And there are 4 different kinds of areas of support that we have identified in speaking with you. I'll expand on that a little bit more in my next slide. And then the final strategic pillar is all about connecting and disseminating. So again, this is the FT3 community of practice that we are developing. And what was important for members and contributors was this idea of train the trainer, or working with ambassadors to be able to disseminate, adapt, and deploy onto the ground. If you could go to the next slide, please, Sylvia. So what does this champion toolbox look like? We have some first ideas, and some of the initial activities that we have been working on, you will find here as well. What we discussed at the board meeting was that this toolbox is still something that needs to be validated and developed. And the idea is that we would work with examples and pilots to be able to do that. But what we have since identified in speaking with you are 4 areas of work within this toolbox. So the first area of work is to develop adaptable resources for patient organizations and healthcare professionals. An example would be this Q&A resource that we've already discussed. Another example would be to take existing good practice resources and to make them translatable with instructions on how to adapt it. And there are some other ideas that have been coming in, such as the need for a plain language guide to the testing report. Another area of resource would be to create a library of patient stories and evidence. And here the idea is to support especially the data and evidence strategic pillar. And the idea would be to collect and link together patient stories and case studies to be able to highlight commonalities in the experiences they faced, but it could also be a benefit to support the systemic barriers strategic pillars as well, because we could be looking for commonalities and access barriers that they experienced and maybe compare the experience of patients with the ideal experience they could have had everything gone to plan. And the idea here is to also be able to identify missing evidence for different precision medicine stakeholders. Another area of resource that we have identified are advocacy tools. So some of these will be familiar to you, such as the country and condition cards. We're also developing a call to action paper in FT3. A new activity that has been prioritized is telling the story of precision medicine and why it matters. And my colleague Nicole will explain to you a little bit more about what we're doing there. And then the final area is capacity building. So this is like everything else that is supporting the FT3 work. We have the stakeholder expectations matrix, which is ongoing. Also the precision medicine synapse, which some of you will be familiar with. We're building a platform that is aiming to, collect the bubbles to visualize the precision medicine community and facilitate collaboration there. And there are some other ideas that have been identified by the members and the contributors as well that we would like to explore in the future. So again, this is the Precision Medicine Champion Toolbox. Broadly speaking, we have identified 4 different areas where we'd like to work. The specific activities, some are ongoing, some are more ideas that we'd like to explore. And this is something that we would like to continue to develop and validate with you. Are there any questions so far? I just wanted to mention also that we will explain in more detail what these specific activities are. So if you have any questions around that, we will I want to reassure you, we will come back to that. No, then perhaps we can move to the next chapter, please, Sylvia. So in this, yes, there's a question. Okay.
One question in the chat. I don't know if you can.
Yes, it was me, but I think it is related to the activities. Hi, everyone. It's Donatella here.
Hi, Donatella.
It is related to the activities, so I'm waiting for the presentation. I don't want to,
Okay, we could
destroy the flow.
Okay, perhaps we can move ahead to the activities, and then maybe we can come back to this question, Donatella, if we don't answer it for you.
Thank you.
Thanks for letting me know. So in this next section, the idea, if you could just move to the next slide, please, Sylvia. So for those of you who are new to the program, we have established working groups for each of these strategic pillars. So there's pillar 1, data and evidence, and there's a working group for that. And there's another working group for pillar 2 and another for pillar 3. What we have done is we have clarified the first deliverables. Some of them you will be familiar with because we have been working on them, but we have also added some new ideas for deliverables based on the discussions that we had at the board and the discussions we've been having with you, with the contributors. And you will have seen in the more recent communications we've sent to you that we are setting up subgroups. And these are production subgroups that are really focused on moving forward with these activities. And we've had really useful discussions early on in the year, and we've made a lot of advances in terms of understanding exactly where we feel we can add value. But now we have that clarity, we're quite anxious to move ahead and to really pull together this first toolkit and to begin to test these toolkit elements. And to support that, we are creating these production subgroups. So everywhere there is a star, we have set up a production subgroup where you can volunteer to participate in. And where there isn't a star, it's either because we are still understanding what we need to do there, or because this is an activity where we would simply go back to the whole group to get feedback on. But what we will do is we will take each pillar one by one, And we will go into a little bit more detail to explain to you what these subgroup activities are doing, what has been done, what's coming next, so you know exactly what you would be signing up for if you are interested in participating, alongside a little timeline to give you an idea of how things might move in the next few months. So with that, I will hand over to Maxi for the data and evidence pillar.
Thanks, Helena. All right, so in this working group, or basically the strategic pillar, it basically has two parts that it's aiming to address. One being the evidence development to demonstrate the benefits, but the other one being the data governance structure or data management. So I will start with the patient-led guiding principles, because I think most of you will be more familiar with that if you're in this working group. So within this working group, we have been discussing a lot on what our first activities can be. And we have agreed that patients should have a key role in data management, but that we still need to understand what their requirements or their needs are for sharing their data and what their role should be in data management. We've also been looking at data models that include patients. We had a presentation by Charlie Stewart in the 100,000 Genomes Project. And we decided that a first stepping stone would be to articulate guiding principles for precision medicine data management. So what has been happening so far, we've mapped a bit, we've identified some existing principles. We had the presentation for the 100,000 Genomes Project, where it basically explained the patient role in the initiative, and we could pull out some good first principles. And then we also had the opportunity to co-lead one of the patient engagement open forum workshops in April. And there was a second one, which we didn't lead, but was also on the same topic, where we were also able to have an interactive workshop with many patients and other stakeholder groups to elicit more of these or get some feedback that can feed into these principles. So what would be upcoming in this subgroup would be to collate all the guiding principles that we have found so far and share that back with the wider group, and then that we would further develop them and refine them. And then a more longer term part would be to, once we have these principles set, to be able to identify any good data initiatives and basically check if they comply with these principles that we have altogether defined. So that was a patient-led guiding principles. Then more like a newer idea that kind of addresses the evidence development. So several members had identified the need that we also need to work a lot on the evidence side and not just focus on the data management aspect. And through many discussions with some members, the idea came to build basically a library of patient stories. And as Helena already said earlier, the idea would be to basically highlight the data and the evidence in these stories, and perhaps even link the stories to the healthcare professional story that is the healthcare professional with the patient story, to get their perspective, so that we can link these stories together and basically show the data behind it. So far we've already collected some patient stories, and then in this subgroup, the next step would be to basically develop a common criteria or a framework to highlight the data and evidence, so that we can basically compare the stories and then basically publish them for feedback. The identified missing evidence for different precision medicine stakeholders is also linked to that. So some evidence will come out of these patient stories, but also within this working group, and this is more linked to the systemic barriers working group, we are doing stakeholder expectations interviews, which I will explain once we get to that working group in more detail. But we were working on specific questions related to data. And basically these questions would be asked to many different stakeholder groups so that we can also identify missing evidence in that regard. And then a more longer term idea that doesn't have a subgroup currently, because it will probably come further down the line. This is an idea that had come up quite early in the process. We had discussed that it's quite difficult to find molecular guided clinical trials and to see what the role can be for FT3. So how can we support the clinical trial matching? But this will come further down the line. Those are the subgroups for now. Does anyone have any questions, or does anyone want to add something from the working group that I might have forgotten to discuss?
Maxi, I just wanted to add one thing for the identified missing evidence for different precision medicine stakeholders. I just wanted to share that another thing that we thought could be beneficial here is to kind of do a mapping of all the different evidence that is already available. So not like all the evidence literally, but the different kinds of evidence or the different kinds of activities that are already happening, and to share that as a learning so that we have a good basis to work from as well. So if you come across any kind of research, really important research or initiatives that you know of that are really working to advance this topic, that would be really helpful if you could share that with us, that we can start to pull that together. And then again, together with the insights we're gathering in the interviews and then the insights we'll gather from the patient stories, we should have a good foundation to be able to really kick off this subgroup. So again, if you know of anything happening or good evidence on about the missing evidence for different precision medicine stakeholders on the value case for precision medicine, please share that with us, and that would be really helpful.
So if there are no questions, should we move on to the next working group? Then I'll hand over to Nicole.
Hey, thanks, Maxi. Good. So I've got 4 key deliverables to talk you guys through under the patient and HCP education and awareness pillar. So we have 4 active subgroups. So we're still driving numbers 1 and 2. Sorry, these slides are in the wrong order, and I've just noticed that now, so apologies. But I'll start with telling the story of precision medicine. So this is an element that supports the mantra of the education and awareness working group, where we really want to support empowerment and informed decision-making, and making sure that the different stakeholder groups have the right awareness of the precision medicine context and the value of precision medicine. So through working group discussions, it was really frequently emerging that there was an expressed need to really tell the story of precision medicine as such. So in the wider context of medical progress and the history of innovation, and utilizing that powerful storytelling as a way to get key stakeholders to understand what it is, the excitement behind it, and the wider context behind it. So we've, until now, convened a subgroup and discussed the needs and approach and first thoughts for further development. And our upcoming activities in this subgroup are around developing personas. And so elaborating within the different stakeholder groups, what does that stakeholder persona or profile look like? And how can we elaborate different storytelling, messaging, and formats and language use and so on in order to be able to really effectively target these various audiences? And then from there, we'll move on to developing a central storyline, and then how we can deploy it through those different personas. And then another element that we've heard a lot about in the working groups is around patient advocate advanced resources. So this is really support for patient advocates on education and training, specifically in precision medicine. And so there's certainly great efforts being done by the patient community to upskill the patients that they serve, and patient advocates within certain networks. But there's an opportunity to bring these things all together via FT3 and support the dissemination and uptake and sharing of these great resources, but also to understand, are there any specific needs and gaps that might exist? And so, as Helena had mentioned before, is there a role that we can play in FT3 to fill some of those capability and knowledge gaps in the expert patient population? So one of our upcoming activities there is working together with the working group of European patient advocates to submit an open call to the WeCan members to collaborate collectively with FT3 to move this forward. So knowing that they'll have within their member organizations a lot of ongoing work and also a lot of insight into what the opportunities are, given that they're quite focused in the WeCan Academy. So my call to action for today there would be, if you're aware of different resources, educational opportunities, webinars, info sessions that are recorded and available online towards a patient advocate audience, then please by all means share those with us so that we can take those into account as we move that work stream forward. And next slide, please. And so the other two subgroups in this strategic pillar, one of them is really supporting, again, the core of the education and awareness working group in terms of facilitating the informed and decision making. So this is, as Helena had talked through before, a parallel Q&A resource that is equally patient-facing and providing support to HCPs. So what are the different questions that you should be asking your physician at different moments of time in the pathway that will that are precision medicine specific? And then on the HCP side of things, how can you address those questions in a patient-friendly way, helping them to understand complex things like test results and diagnostics reports and so on. So some complementarity in that resource. So this has been a culmination of a lot of work within the working group. So thank you to everyone for all of your careful review and insights. We have a first draft of the Q&A that's been reviewed, and we're actively consulting with the healthcare provider community. And then we'll be finalizing that HCP outreach and launching the Q&A for public consultation roughly in the window of Precision Medicine Month. So that's where we're at there. And then the last subgroup in this pillar is curating a library of adaptable resources with repurposing instructions. So this is providing support for patient organizations, promoting transferring of learnings and support and resources that have been developed in other countries, in other disease areas, and making them adaptable to be able to be used in different contexts. So we're actively adding to our repository of patient resources that can be adapted here. And we're actively deploying a process of the adaptation for some of those resources. And then the upcoming activities is to co-create further those first adaptable format resources, and then consult more broadly with the FT3 community on those first drafts. So again, here, my big ask would be that if you know of really great patient-facing information resources from any geography, any language, any disease area that you think would be ideal to be transferred into an adaptable format as a resource for patient organizations, then please pass those on to us. Our approach in the working group that we've discussed extensively was building on advice that we need to take a bite, snack, and meal approach to providing information. So looking for smaller bits, 2-page, easy to read, easily digestible information straight through to the meal side of the spectrum of more comprehensive patient guides and so on. So making sure that we're covering different formats, different lengths, and of course the critical topics of patient information and support throughout that process as well.
Perhaps we can move over to systemic barriers.
Great, thanks.
Okay, systemic barriers. So basically we're trying to build the accessibility conditions for precision medicine. And how are we planning on doing this? So this group, actually the subgroups have started a while back. So we're quite, we've advanced a bit on the two different subgroups that you can see here. So the first one is the country and condition cards. And if I understood your question correctly, Donatella, then this is probably the activity that hopefully answers your question. So the country and condition cards, we have basically, the aim is for them to be a practical tool for advocates working to advance access to precision medicine in a given country or for a given condition. So basically these cards would give us a snapshot of precision medicine access by mapping different parameters that we have started to define within this group. So that can be, I don't know, reimbursement of a specific test, etc. As Helena mentioned earlier, we had initially mapped 75 access barriers, and we have now condensed that down to, I think, 10 key parameters. And we have now started to work on 2 prototypes, one for the Netherlands and one in Ireland. So that is in progress. And once those are done, that will be shared back. And if you are interested in joining this group, the next activities would to extend these prototypes to other countries. So to create more and more, and also to start thinking and to define what parameters could be included in condition cards. The other activity that has also been running for a while is the stakeholder expectations matrix, or the stakeholder expectations interviews. These have the aim to find out what different stakeholder groups expect from each other in the precision medicine realm, and also to use the opportunity to validate some needs assumptions that we may have in the program. So as I mentioned before, we do have some questions related to data and evidence. So we have identified within this group that we would like to interview around 7 different stakeholder groups. And basically the first part of the interviews will always be the same, because that will lead us, or the outcome will be the matrix. So these questions, this will be like the expectations part of the interviews. So these questions are the same across all stakeholder groups. And then the second part is tailored to different stakeholder groups, which is why here it says that we have already finalized the patient advocate or patient organization questionnaire, as well as the healthcare professional questionnaires. And we have started the pilot interviews, and we will continue doing that throughout the year. And then within this group, the upcoming activity would be to create the other questionnaires or the interview guides for the other stakeholder groups, for example, payers or regulators, and to continue recruiting and doing the interviews. Maybe a small call for action here is if you know of any healthcare professionals that you could recommend for such an interview, please, that would be great if you can refer us to them. Then on the left, you can see access barrier cause effect canvas. This is actually a new idea that doesn't have a subgroup so far. It kind of, it's been an idea that we've been exploring on our end. It came out of a good practice from different resources. One of them was a longevity resource. And we're exploring how it may be a resource for advocates. It's basically showing, and maybe Helena, if I explain this wrong, you can jump in. It's basically explaining the different barriers and the good practices along the patient pathway in a very visual way. And we're trying to make it a replicable resource that can be used by other stakeholders. And then the last point, which is identified replicable best practices. This is kind of, I want to say it will always be a rolling. So every story or every that we receive, we will always try and identify what these best practices were, and to collect them all in one place. So that is basically, I would call it a side activity that we will try and utilize whatever resource we have to do that. Helena, did I explain the canvas right? Otherwise, please.
Yes, no, you did really
Feel
well. So it's indeed, it's something that the idea came from some really interesting examples that were shared with us. So there was a longevity one that Maxi mentioned. There was also another one, an interesting paper that was shared from the IQVIA Institute, and then another really interesting publication from Rare Cancers Australia. And the idea is to create a resource for advocates to help them map the patient pathway in different, in different conditions and geographies or in different situations. And then at different points in the pathway to identify what are the barriers that are being experienced, and then also to help them identify potential solutions to these barriers. In doing that and in developing this kind of visualization of the pathway, we think it could actually be really interesting to anchor a lot of the work that we're doing. So for example, when we're thinking about these patient stories, it could be really interesting to have like a common, we talked about this common framework, but like a common visualization of the pathway that the patient is experiencing to make it easy to compare and contrast the different experiences of different patients, and to highlight like different barriers they're facing, different good practices maybe that they experienced, and basically make it easier to pull these different stories together and different examples from different countries together. So this is something, again, we didn't create a subgroup because this was quite a new activity, but it's actually something that's moving quite quickly. So what we'll do is once we get it to a stage that's ready for further development with the group, we'll just share it back with all of you so that you can share your feedback there. And then indeed with the best practices, it's really similar to the approach in education and awareness, but the idea is to look for good practices in how access barriers have been addressed and to turn them into like a replicable resource that others can benefit from. So this is really, you'll notice this as a theme, that this is really what we're trying to do in FT3 across the different strategic pillars, always looking for learnings, always looking for good practices and looking at how can we make them, capture them and make them replicable so others can benefit from that, and to help accelerate precision medicine in different contexts. Okay, so perhaps we can move to the last slide, please, Sylvia. So we have 5 minutes left. So with the 5 minutes left, we have 5 ideas for you to get involved or to engage your colleagues in your network. So the first way you can get involved is to join one of the production-focused subgroups that were just presented. And Maxi will be sharing a link soon. If you haven't told us, some of you have already told us that you're interested in joining, which is great. But if you haven't told us yet and you're interested, you can just go through that link and answer this quick survey to tell us where you're interested in participating. We are also, as you have seen, really interested at this point to collect patient stories and examples of precision medicine from different countries. And these stories could be examples of where a patient had to go out of the way to benefit from precision medicine therapies, and they had a better outcome as a result. It could be a story where that is illustrating a gap. All different kinds of stories would be really helpful in different aspects across the program. So please share with us or give us ideas of where we can find these stories. We're also looking for good practice resources in precision medicine. And again, these could be resources that are more educational resources for patient organizations, for example, or they could be resources for other stakeholders and resources for addressing access barriers, for examples. And we're also really interested as we start to pull together this toolkit, we'll be ready to start testing and piloting. So if you have any ideas of any countries or opportunities that we can fast track for demonstration pilots or for tests, please share these with us so that we can take them into account. We already have some suggestions, which is really helpful, and we'd like to hear from all of you. And finally, you may have heard again about precision medicine signups. We'll circulate these slides so you have the link, but you can go there. It's still in beta, but it's a place where you can go and explore the precision medicine community, and you can help us build it by sharing it with your network and also helping us populate it with content. So this means initiatives, events, resources, people who are working in precision medicine and help us really connect the precision medicine ecosystem and reduce fragmentation. So that is another way that you can get involved. So again, please let us know where you would like to be involved in the link. Here are 5 ways that you can get involved, and you can also share with your network as well. We really appreciate your participation so far. We're looking forward. We're really excited about the next steps and the work that's ongoing. We're also interested in hearing what you think about the town hall format. It was a bit of an experiment, but if this is something that you find helpful, then this is something that we could do on a periodic basis so that everyone has the opportunity to have a good overview of what's happening in FT3, and maybe in the future also sharing progress as well. So please let us know what you think. We'd be really happy to hear from you.